It's 4 a.m. and your child has a fever. What do you do? First, let's make sure they actually have a fever. What temperature qualifies? If you do the thermometer reading orally or by mouth, it's anything above 99 degrees Fahrenheit. If you do the reading rectally or in their butt, it's anything above 100.4 degrees. Let's talk about infants. So for children less than 2 months old, we worry if they have a temperature over 100.4 because that can be a sign of a serious illness. The good news is that most of the time, children will recover and be just fine, but we do want to see them as soon as possible. And so if your child does have a temperature above 100.4 and they're less than 2 months old, please contact your pediatrician as soon as possible. Thankfully, usually they are okay and don't need any urgent care. So let's talk about fever in older kids. Fever can be a sign of many things, not just being sick with a virus or a bacteria. And so you also want to be looking at how a child is feeling and acting while they have the fever. Signs that a fever might be causing a child to feel ill is they have less energy. They might complain about headaches, pain in other parts of their body, or they might just be sleeping all the time. So sometimes a fever is okay. If your child is otherwise acting well, bouncing around the house, and has a fever, that's something that you can just watch. You don't even need to give a medication for. But if they aren't feeling well, if they have a fever and a cough, if they have a fever and they're really tired, giving them some medication and seeing how they respond might be a good first step. It would be very rare to call 911 or have to go to the emergency room for just a fever. It's really a fever and a child feeling ill some other way, whether they're coughing, struggling to breathe, having headaches, that if it's a really high fever, you would want to go and seek medical attention as soon as possible. If you're looking for medication to treat your child's fever, you can start with Acetaminophen or Ibuprofen, which are common over-the-counter medications that can be safe for most children, but you will want to talk to your doctor about what is a safe dose for your child. If you find this content helpful, please subscribe to the AAP YouTube channel for more. One note about giving over-the-counter medicines. Call your pediatrician right away if your child throws up a lot or gets a rash after taking any medicine. They might be allergic to it, and never give your child aspirin unless prescribed by their doctor.